Okay, so really quickly, talking about the concept of oxygenation, I had mentioned, I'm not sure if when I lost you guys online. So I had mentioned about the physiological aspect of knowing the passage of the nose to the alveoli and how it's important to know the passage just in case, there's a question that's referencing it, what it's talking about. We talked about the importance between diffusion and perfusion, right? In order for anything to be perfused, it has to diffuse first. We talked about VQ ratio. We said we're looking at increase and decrease, and we also always want to consider the V in that aspect, right? Increase VQ is in reference to the ventilation is increased, which means the perfusion is decreased. Or if it says decrease VQ, we're thinking about decreased ventilation and the perfusion is increased because one is lower, one is higher. So when we think about increased ventilation, we're thinking about more oxygen, more air coming in. And when we think about decreased ventilation, that's less oxygen, less air coming in. But if one is low, the other is high, right? And so we can understand that concept between the two of them. We're not worried so much about the numbers. Not going to touch on that. Now, assessment. Assessment is, it's really simple, but the difference is knowing early and late, right? But in general, we want to ask them about their, nutrition. And why is the nutrition important? The nutrition is important not just to make sure they're eating adequately, but we know that if a person is having trouble breathing, it's like I can't chew and breathe at the same time type of thing, right? So it's going to be diminished. It's going to take up space and time for them, and they're not going to eat as often because it's laborious. It takes time, it takes energy. So we're looking at that. Hydration, we're thinking about, it depends on which problem we have. Hydration helps with mucus. So if the mucus is thick and it's a lot, if you hydrate it, it'll be lubricated more, right? Stress and cope. We know stress causes anxiety, it causes constriction, it causes heart rate increase, like that burns energy. They don't have energy, right? So we want to make sure we help them with that. And that includes in their activity, right? Activity tolerance and grouping things together when you need to so they can get it done, and then all of that. Also with the nutrition, we didn't mention calorie. So when they do eat, we want to give them as much calorie as possible and not fat or carbohydrates that's going to be burnt up really quickly type thing. Medication. We want to know which, respiratory history. Do they have a cold? Did they have a flu? Do they have asthma? Do they have COPD? Some are more, what should I say, like it makes you more prone for the other depending on what you have. So you want to check that out. What else? Then we have medication. What medication are they taking for whatever problem that they have, right? We know albuterol for asthma, right? We know corticosteroids also for asthma. So in their lifestyle, are they sedentary? Or are they very active? So we know a very active person is not going to have respiratory issues as much. There was a question I remember in reference to the person, is doing a lot of, I don't know, they're like highly active. And that was part of the answer. So that would never be a choice for respiratory issues because he's active, right? I don't remember what the question was, but I remember noticing that. So if a person, the problems with any disease is usually sedentary, it's usually eating too much or not eating the right food. It's usually smoking or alcohol. Like those, they're key things that gears or make it more possible for a person to get sick, right? And that also goes into the range of, age too, right? Like how much can you do when you're older? Like, unless it's a really active older person, like, so younger people have less risk in becoming sick and that kind of thing. So we see that. And that goes into the risk factors with genetics and age and lifestyle. With genetics, I mentioned that a person with asthma has the possibility of having eczema, right? It's kind of like connected. And the reason I mentioned was because just to show you how one thing can lead to the other. So inflammation of the insides, inflammation of the outside, like it makes sense, they're connected, right? So that's how sometimes one thing in the genetics can cause the other. And you see that we talked about age just now, lifestyle, we talked about medical history, activity, gender. Those are some of the risk factors. And sometimes too, the questions are, which of the risk factors can be avoided and which ones can't? You can't avoid your age, you can't avoid your sex, you can't avoid your race, right? But everything else you can work on, okay? Then we have inspection, palpation, percussion, auscultation. These are things, they're the basics that you have to know, right? They're not going to ask you necessarily how it's done, but what you find when it's done, right? Inspection, what are you going to see when a person has respiratory issues? Yeah, you're going to see like breathing, accessory muscles. We're going to see skin issues with cyanosis, right? Clubbing of the fingers. Like there's a lot of things we can see that tells us either it's an acute or it's a chronic, right? And identifying that, I think there was a question on that. And it was saying the person had an acute issue, and then there were some answers that had chronic, and they were asking for the chronic, right? So clubbing of the fingers is a chronic thing, right? Cyanosis is not, because if cyanosis becomes chronic, what's going to happen? You're going to be dead, right? Like you turn blue for too long, we can't get you back, right? So, and then we have the palpation. What are we going to feel, right? Respiratory, we talked about crepitus, right? Which we don't really feel like that, but it is there. Then we talk about percussion, and that one is like the timpani, right? Tapping. Is it hollow? Is it dense? That means, does it have fluid or does it have air? Like that's what that's telling us. Auscultation, that's the one they focus on the most. They focus on the auscultation and the inspection, but mostly on the auscultation because inspection, remember what we said? We can't really measure it as much, right? And it doesn't necessarily define what's going on the inside, or by the time it gets to the outside, the inside is raving and raging and it's dying, right? By the time you become blue, that means you've been sick for a long time. So if I'm looking at only the inspection, it's a problem. But if I auscultate and I listen, I can hear what the problem is. The same thing with the measuring, right? So if I hear crackles, if I hear wheezing, that's telling me something. But even still, that's not as good as taking the measurement. Because there was another question that referred to wheezing, right? No wheezing. What does no wheezing mean? Not breathe. Exactly. Some people thought, oh, it's fixed. It doesn't mean necessarily that it's fixed, because it might mean that it's closed all the way, right? And so that's why we want, how are we sure that it is open or it's closed? The oximetry. That number will tell us. If it was open, it'll be 100 or 98. That means no wheezing means because of the oximetry, it's open. No wheezing mean when I look at the oxygenation and it's 88, oh, it's closed all the way, right? So it's not the wheezing that told me that answer, it's oxygen. And see, that's why I keep going back. And doesn't matter. It's always check the numbers. That's the answer. If that answer is there, that's the answer you pick, okay?
Was that a question that was asking, like, how would you determine if the problem is fixed? And then it said like wheezing's gone, O2, like that. I think
there are different kinds. There are different kinds. I don't remember, and that's not the point in trying to remember which one. It just came to mind. But what I want you to understand is when you're assessing for either the problem or the solution, you want it to see the numbers. The numbers will tell you. If someone is at 33 and you know the norm is 12 to 18, that tells me the person has a problem. But if I'm going to see the solution of that problem, I am not going to just look at, I might, even though 33 to 18 is good, that is not as good as if I check the oximetry and it tells me it's 97, because that oximetry tells me exactly what the blood is doing. And that's what matters the most. Because remember, we said the breathing is not what matters, because what? I said my friend, right, when after she inhaled the grass, she was breathing. And maybe she wasn't breathing that fast. She was breathing. but it wasn't getting into the alveoli. So the breathing rate is not what tells me the person is breathing. It's when that breath reaches the alveoli, when that exchange happens. Do you see the point? All right. So now the interventions, we're looking at improving nutrition. So giving them to eat when they're at their highest, or giving them high calories, giving them medication, the appropriate medication. What medication were you using first? Albuterol, right? We want to pop that thing open. Albuterol is a vasodilator, right? So albuterol is a vasodilator, and then we want to keep it open. How? Corticosteroids, because what do corticosteroids do? They're in. And see, this is my problem with y'all. It's my problem. You guys remember facts, but you don't remember the meaning behind the fact. So just remembering corticosteroids is not enough. That's the point. That's it. If you know that corticosteroids is an anti-inflammatory, then you'll always understand the reason behind why you use it, and you'll never get the answer wrong, right? Even if they use a different drug, but the concept behind it, and the reason why is like albuterol is a vasodilator. That's why we want to remember albuterol. It's a vasodilator. It pops it open. Corticosteroids is an anti-inflammatory, so it keeps it open by reducing the inflammation. So we don't want to work on the inflammation first, and why is that? It takes time. When you think about it, it took time for something to swell. It's going to take time for it to deflate, right? So that's why we don't want to give them corticosteroids. We want to just pull a thing open, and that's what a vasodilator does. Then, as it's open, we keep it there, but it's still thick. Then we want to decrease the thickness so that it remains open. You see the thought process behind that? Now you're always going to remember that, right? So then we're going to give oxygenation, right? Once we give the medication, and even before we give the medication, I think that was one of the questions too, right? Our first action is giving oxygen. It's not stopping them. It's not telling them to calm down. It's none of that, because while we do those things, they're getting oxygen. You see how the sense of that makes? Because the thing is, we're rescuing them first before we teach them, right? They're not going to listen when you tell them to slow down, because they just can't breathe. You know what I mean? So you want to give them the breath, give them the air, and then you want to talk to them and tell them, next time you want to slow down. Next time you want to, let's take it a little slower. But as you're slowing them down, they're getting the oxygen. Because if the air is already closed and they were already breathing at 88, slowing down, it took them time to lose oxygen. It's going to take them time to regain oxygen. And remember, once it into the alveoli, it has to run through its course until it gets to the extremities. That takes time. So we want to give them 100% of oxygen so that it gets there faster, right? So oxygen is definitely important. It's the first thing you do. If it's not there, then you want to do the other things, right? But if it's there, and that's the thing too, nursing is not a one size fit all. Always do this. And that's sometimes what gets you guys tripped up, because you're like, you remembered give oxygen, but it doesn't say give oxygen. Like, what do I do now, right? And I get that, but if you understand the concept behind why you're doing this, then you can see what the next steps might be, right? Again, it's what's the best answer. It's not that we don't tell them to slow down. So then if oxygen is not there, then there might be lifting up the bed. If that's not there, then there might be, tell them to take deep breaths, but we want to choose the best thing. Okay. So independent, that's the other thing. Oh shoot, look at this. That was an exam question. I don't even know. The independent versus the, okay, so what does the nurse do independently? Oh, yeah. Remember that question, right? And it was like, but it could have been this one. It's right here. So the point is, there's certain things that you teach the patient to do, and then you can leave them, right? Deep breathing exercises. They don't need you to do that. As a matter of fact, how many times does a nurse go in to see the patient, right? Like in a day, they got 3 times to take medication. Right? When you think about it, you can't only those 3 times, tell them how to breathe. So that's what we think about. Independently, we're telling them to do the thing and we're expecting for them to do it throughout the day, right? So breathing exercising, reposition. They have to reposition every what? 2 hours. You can't be in there every 2 hours, right? You got to let them know, listen, if you move, if you stand, if you sit, if you shift position, that's going to help you, right? Encouraging smoking cessation. You don't need to be there for that. Monitoring activity intolerance. Even though it says monitoring, and you're like, well, the nurse has to be there to monitor them. But once I see it, I know, okay, this is not something that they can do. I'm not going to allow them to do this at this time. So I'll tell them, listen, I noticed that, when you bend down to tie your shoes, you get out of breath. So next time, lift your foot up and tie it that way. Next time, call me. That's a teaching that you can walk out the room and expect them to do it on their own and remember, right? Assist with ADLs, showing them how to put it on and what to do, right? And I think that kind of threw people off because they saw the assist and they're thinking someone got to be there, right? But the thing is, I can be there and say, okay, now, now put it over your head, now do this. And I don't have to physically do it either. You got to make the question work for you so that you can understand this. And that's the other thing too. And this is when I said the difference between knowing you use corticosteroid and understanding what corticosteroid is. A lot of times when you guys read this thing, you read it and memorize what the words are saying. But what you don't do is say to myself, what does it mean to deep breathe exercise and connecting that? So when I say monitor tolerance, right? And that might have not been my initial thought process. But now that I know it says that, how do I make it work for my mind so that I can remember it next time? You see what I'm saying? So I make it work and I make it make sense. Make it make sense, make it make sense. I make it make sense. And now I'm not remembering the words and the terms, but I'm remembering the idea behind it. And with understanding the idea, if they don't use those words, I still have the concept and the idea. So if they use other words, I still get it. Right? But if you're focused on just remembering the words, when you don't see the words, you're lost. Okay. So promoting suction clearance. And I always try to do that. You see that in class, right? I don't just read through it, but I work you through why it's written there, right? So promoting suction clearance. So we know that the person can't do suctioning, right? So that's not what it's saying. The nurse suctions. So obviously, if this is an independent, that's not what it means. But there's clearance that could be coughing up, right? Shifting, changing position, drinking more water. I'm promoting suction clearance. So when I come back, I'm going to be able to suction you better if you were drinking water. That is something that I taught you that you can do independently. You see what I mean? So we're making it make sense for us so that we can understand. So the suctioning now, see, that's an independent, that's not necessarily an independent, but you see the star there. So that one, I'm not sure how to explain to be real, but I see the asterisk there, and it's possibly there because it's more so a dependent than a non-dependent, but it's not a medication. So if the person is possibly capable of suctioning themselves, and like we've seen, and again, I'm making it make sense. You've seen on television when they have the Yonkers and the person suctions their mouth, they suction their own mouth when they can't produce the saliva. So that's how I make it make sense so that I can remember this, right? But I didn't see medication administration here. And that was the answer that was incorrect, right? Okay. And that was that with oxygenation concept. Okay, what was the next one? Acid base. All right, so it's 12 o'clock. I think I can do acid base, and then that will be the last one because I have to meet someone after this. I was hoping, let's see. Carmina, yes. Are you cool with that? Yes. Okay. I was trying to find out not to say it was you, but then I realized you're here. You're the one I'm meeting. What is it? You said acid base. Oh, where is it? Acid. There it goes. Okay. Oh, so to me, like honestly, acid base is the easiest. right? Because once you know those numbers and what the numbers mean, like, I don't want you guys memorizing, because it's that memorization that's going to throw you off, right? Because it's hard to conceptualize the memory of it, but it's not hard to conceptualize the understanding, right? Because you literally have to be like, when it says acid, like, is this an acidic thing? You got to be like, wait, hold on. So what does acidic mean again? Like, you got to go through that understanding enough in order to kind of remember, right? So let's work through this. So the most important thing we know is definitely knowing the pH. pH is?
7.35.
That's right, 7.35 to 7.45. 7.35 and below means acidic. 7.45 and above means basic. So that's the key. That's the first thing we got to know. But then we got to remember what CO2 is, not what the numbers are, what CO2 is. What is CO2 when we consider acid and base? Which is it? Carbon dioxide. When we consider acid and base, which is it? It's acidic. Carbon dioxide is an acid. Okay. That's all I need to know. So according to the numbers, if carbon dioxide is a lot, high number, what does that mean for that person? We don't want the respiratory yet. We just want to know, are they acidic or are they basic? They're acidic. So carbon dioxide is an acid. If I have a lot of it, I'm going to be acidic. I need to know that. Carbon dioxide is an acid. If I have a little bit of it, I'm going to be basic. Carbon dioxide is an acid. But if there's a little bit of it, I will become basic because there's not enough acid to neutralize the base. Why? Because the body has both. Right? The body has both. That's why it could either become acidic or basic, right? Depending on which level it is. So if I have a little bit of acid, the base is still here. So it trumps, it's over. It's prominent. Okay. Now, bicarbonate, what is that? It's a base. It's a base, right? So if I have a lot of bicarbonate, what is the body going to be? Basic. If I have a little bit of bicarbonate, what is the body going to be? Acidic. Again, because there's both inside. So when one goes down, the other one is still there. It's not changed, right? It's going to be trumping. Okay. That's the concept I need to know, right? The numbers, that's what they mean to me. Then now I want to look at what they mean in relations to acid and to pH. So I said, and we're coming to you, Andrew, right? If carbon dioxide is high, oh wait, no, that's the second concept. The third concept is what Andrew is saying. Carbon dioxide is controlled by what? Respiratory, the lungs, the respiratory. Bicarbonate is controlled by what? The kidney or the metabolism, right? It is the kidney, but metabolism, right? And the reason why I like to say the kidney is because the metabolism can also cause can cause basic or acidic issues as well, right? But we want to say the kidney. Okay, so now that we know pH is important, that's the first thing I want to know, whether pH is high or low. Low means acidic, high means alkalinic. That's the first concept. Second concept I want to know is, what is CO2 and what is bicarbonate? CO2 is an acid. If there's a lot of it, the body's going to be basic. If there's a little bit of it, if there's a lot of it, the body's going to be acidic. If there's a little bit of it, the body's going to be basic. Then I need to know what bicarbonate is. It is a base. If there's a lot of it, the body's going to be alkalinic. If there's a little bit of it, the body's going to be acidic. Those are the things. Then I need to know which one regulates which. Lungs regulate the carbon dioxide, so it's a respiratory problem. Kidney regulates bicarbonate, so it's a metabolism problem. Okay, those things I know. Now, here's what problem people have. When they see the pH go up or down, and how it connects to CO2, in their mind, they're thinking the pH is in direct relations with either CO2 or the bicarbonate. And that's not true. Meaning they think if CO2, CO2, if the pH is low, then automatically that means that means carbon dioxide is low. Because they get the point. They get the point that CO2, sorry guys, I know I'm confusing you. Hold on.
In low, if the pH is low,
right,
I automatically think the CO2 is high.
That's what they should think.
Oh.
That's what is right. That is right. That is right. When CO2 is low, that means carbon dioxide is high. Yes, when CO2 is low, that means the body is acidic. When the pH is low, what does that mean? Body is acidic. That means CO2 is high because that's carbon dioxide, right? They are inverse of each other. They're not directly, you see, so people confuse it because they're like, pH is acidic, carbon dioxide is acidic. So if pH is low, carbon dioxide is low. No, carbon dioxide is high because it's a lot of acid. pH is low when there's a lot of acid. So I don't want you to think of arrows and directions. I want you to think of what the thing means. You see what I mean? Once you got that, Carmina? Right. So when CO2 is high, there's a lot of acid. A lot of acid means pH is low. Bang. That's what we need to know. And it's the same thing with the other things. Once I know what they stand for, and if I know their numbers, then I relate them to what the pH is. All right. Okay. So we're good with that. Now, the other part that gets people confused is we got the numbers, some of us, but it's the information behind the numbers that bothers us, right? What are we going to see? So there's a difference between what the person is going to exhibit and the solution. When the person has a respiratory acidosis, let me get there. When the person has respiratory acidosis, we're going to see, okay, we got to think about what it means. What does it mean? Respiratory lung issues, acidosis, carbon dioxide. Okay. Carbon dioxide is high. What caused it to be high? So the point is the carbon dioxide is trapped inside and it keeps accumulating. So that's the understanding. So that's what's happening. Now, if they're saying what's happening, that's what we have to say. Then we got to see what could cause that. Anything that causes trapping will cause it. Anything that causes a decrease in respiration will cause it. So understanding what respiratory acidosis means, carbon dioxide stays inside. So what causes it to stay inside? Okay, so that's what caused it. Now I have to understand when the person does that, when the person is in this state, what does the body do to help get it out of there? So it's going to do something that's opposite of what it's feeling. Hyperventilation, because it's trapped. So what had happened is it was not ventilating. It was keeping inside. So body said, no, you gotta be faster, That hyperventilation is helping it, but that is not what caused it. And that's the problem, right? So when you read the term, see to yourself, what is this problem caused by? Then think, what would solve the problem? Then look at the term in the question and try to identify what it's asking, because that sometimes it's the terms, right? You know, like, are they saying this is a treatment or are they saying this is the problem? And look, you can always ask me, please do. Like, I need y'all to ask me more questions because I will guide you, right? I can't tell you the answer, but I will guide you and help you understand, like, this is what we don't want. right? We're looking for opposites. Like this says a negative, right? Because, honestly, I think you have the answer and you know the answer, but if the words are tripping you up, that's stopping you from expressing what you already know.
Relating that, could you explain acid base in terms of like
Asthma too, sure. So the asthma, so we'll get to the asthma, right? But let's get it right there. So the asthma is vasoconstriction, swelling, vasospasms, a lot of mucus, right? Because of the sensitivity of a trigger or something. So the trachea is closing in, and we think about the wheezing, and we say wheezing happened because of the closure. There's a little bit of passageway. And God forbid, when we said no wheezing means it might be closed all the way and they can die. So if it's closing, air is not going out. What air comes out of the lungs? CO2. So that's why with asthma, we're going to have respiratory acidosis, right? Because it's with COPD the same, right? Because we're going to have a trapping, the the oxygen comes in, but the CO2 can't get out. So all these obstructive diseases, obstructive closure, can't come out. It's going to be respiratory acidosis. Yeah. So
I guess I'm confused. I thought that respiratory alkalosis is when it's trapped.
no, so alkalosis means what?
Basic.
So mean there's more base.
Inside.
Right, there's more base inside. So the base, is carbon dioxide a base?
No.
So what's trapped inside with the respiratory? What's trapped inside?
Carbon dioxide.
Carbon dioxide. Carbon dioxide is an acid and it's trapped inside. So you're going to have respiratory acidosis because the carbon dioxide can't come out.
And that's for
Asthma.
hyperventilation.
So no,
Well,
it would, listen, hyperventilation is the solution.
Okay.
So with a person with asthma, they're going, and this is the problem, right? Because when you see a person with asthma, you say they're breathing fast. So you're like, well, they're hyperventilating. But remember I said they're breathing fast, but the air is not coming into the alveoli.
Okay, so yeah,
So that's the problem. They're hyperventilating in order to get the carbon dioxide out.
but it's not going.
But that's not what caused it.
But it's still not going.
It's not going in. It's not going in. We got to vasodilate them.
So then what's the status asthmaticus?
Right. So the status asthmaticus is it's trapped. And they trap again, they trap again, because it's like constant asthma attacks. That's what asthmaticus is. So it keeps staying inside. Okay. So now the hyperventilation is the solution, Rachel. It's the solution. We want them, we tell them, keep breathing, breathe, stay calm, right? And we want them to deep breathe, right? They're shallow breathing. They go, shallow, but we want to go, like we want them to get it and come out with it. So identifying what's happening and what their body is doing to compensate, right? So sometimes we see the compensation and they ask us about the compensation and we're thinking, oh, this is their problem. That's not their problem. That's how they're compensating.
So they're compensating by hyperventilating.
Yes, because they want to get rid of the carbon dioxide that's inside.
But it's still not really.
It might not help them at all, because the thing is, the problem is not the hyperventilating. It's not the ventilating. The problem is opening the trachea. So now once I give them the medication, that will solve their problem.
The hyperventilation is the body trying to fix acid base, but because the asthma is still not working.
Yes. That's right. So the term of the question is what's going to help us see. It's the way the question is asked, right? So when you're confused, ask me to see, so I can clarify, so I can tell you it's asking this. It's not asking what you're thinking, but this is what it's asking, right? And then as you do the questions too, I see your hand, Carmina, take note of what the answer is and see, oh, this is how they ask the question. So when they ask it this way, this is what they're looking for. and then see when the answer is like hyperventilation or when the respiratory acidosis, like they term it this way because it's honestly it's how they ask the question. That's the problem. Go ahead, Carmina.
So, what was the difference between status asthmaticus
And regular asthma. So the problem, there's no difference. They're both asthma, but the status asthmaticus is an asthma attack that is not relieved. So it's like, it's trap. Like they don't get a chance to get it out at all, right? At least asthma attack, once it's relieved, they get a chance. But the fact is it's asthma, okay? So yeah, it's just asthma. It was just that term, you know?
Is there further to that question?
Yeah,
Yeah.
yeah,
Yeah, never mind. Oh, it's
But-
hyperventilation.
yeah.
But it would, I guess, if you're talking about this woman, it would make sense of respiratory acidosis because by then they're not.
They're not
They're
getting the
not
carbon
breathing.
dioxide out at all. It's
Yeah.
all trapped. It's like every time they get a little, it traps again. Every time it traps again. So it's like constantly staying inside. The same thing with asthma. It's the same thing. It's just that this is prolonged, right? And it's because asthma, by the time you get to respiratory, the body has such a good buffer system that it doesn't allow you to get into acidosis. So asthma patient might not get into acidosis because it won't be trapped for that long. But asthmaticus, for 30 minutes, a whole hour of coming in and out of asthma attacks, you gonna have respiratory acidosis. You see, because there's no relief, you understand? And that's the thing. Same thing with seizures. You'll see when you have epilepticus, it becomes a problem, not because of the seizure, because seizures happen in seconds. Like we measure 2 seconds, 3 seconds, but it becomes a problem because every time that second happens, you're not breathing. But if you have 30 small 2 seconds, eventually you're not gonna breathe for real. You know what I mean? So it's the length of time. Okay, so let's go back. So what I want you guys to do is when you go read on respiratory acidosis, metabolic acidosis, because I want to give Carmina a chance. I want you to look at, and I think we'll start with this on Thursday as we continue. So I want you to look at like respiratory acidosis, what is happening, right? Hypoventilation you see here, that causes hypoxia. And I want you to understand they're not breathing enough to get rid of the carbon dioxide. They're not rapid, shallow respirations. The rapid, shallow is their compensation. You see rapid, but it's shallow. It's not getting out enough. So this is what you're going to see. This is my friend, right? That's asthma, right? But the thing is, because of the shallowness, it's not working. And because it's not penetrating enough, it's not working. You see what I'm saying? So that hyperventilation, it's not hyperventilation because there's ventilation in hyper. This shallow, there's no ventilation because it's not penetrating. You see what I'm saying?
Mhm.
This is how we make it make sense.
Mhm.
Because what confused you is, well, I remember seeing rapid and fast and why, but I thought it was slow. So why is it rapid? But you didn't catch the shallow.
Mhm.
So we make it make sense.
Mhm.
Then we have skin mucus pale. So I want you to make everything make sense. And if it doesn't make sense, I need you to look it up. Type, why is there a headache in a person with respiratory acidosis? And the reason because there is respiratory, headache is because there's carbon dioxide that's stuck in there. Carbon dioxide does cross the blood-brain barrier, right? We're going to see they're a little out of it. The oxygen is not getting inside. So the oxygen, there's more carbon dioxide than oxygen. The receptors like carbon dioxide more than they like oxygen anyway. So the little bit that does get inside is not getting to the brain, right? So you're making it make sense. So I want you to do that for each one so that you will remember each aspect for that one. Okay. So I'm going to stop here so I can go ahead. Mhm.
Not to be pushy, but is there any way to